Hi, this is Melissa Christensen. Thank you for watching my video on post-acute withdrawal syndrome in the opiate-dependent person. Opiates are a naturally occurring product produced by the body in very small amounts. They hook to the opioid receptors in the brain to create a feeling of mild pain relief and relaxation. The opioid drug use exposes the opioid receptors to much larger amounts of opioids than what is created by the body, and those attached to the opioid receptors. Opioid use creates triggers in the reward center in the brain and cause the body to have a strong feeling of euphoria and relaxation. With continual use of excessive opioids in the system, the brain starts to demand more opioids in order to trigger the reward center, and this gives that sense of euphoria. The brain is essentially rewired to demand the opioids, causing the addiction. After a period of time of drug use, the opioid receptors actually become less responsive to opioid stimuli, and over time, the brain begins to function better with opioids in the system than when there is no drug. During recovery, the healing of the brain can take up to 2 years to get back to normal or close to normal. In the acute opioid withdrawal period, many of the symptoms are physical. Symptoms to look for include elevated pulse, sweating, restlessness and pupil enlargement, bone and joint aches, runny nose, sniffling or tearing, GI upset, including nausea, vomiting, and diarrhea, as well as tremors, excessive yawning, anxiety, irritability, and goosebumps. These usually start within 12 to 48 hours after the last opioid use, depending on the type of opioid used, and last anywhere from 7 to 14 days. In an outpatient care setting, these symptoms can be treated with medications such as buprenorphine, which blocks the opioid receptors and helps calm the symptoms, without giving that euphoric feeling of opioid use that you will find in heroin, heavy methadone, and oxycodone use. Post-acute symptoms can happen anywhere from after 2 weeks of abstinence and can last from 6 months to 2 years. Post-acute withdrawal individuals tend to show symptoms differently and may include a few or all of the symptoms. They vary in severity, how often they occur, and how long they last. These include an inability to think clearly or track a thought process, memory problems such as forgetting to do a task they are given at work, or forgetting the steps needed to complete the task. Often a task can be completely understood, but then within 20 minutes the details and steps will be forgotten. They also tend to have periods of emotional overreaction, alternated with a numb feeling or a sense of no emotion. The most common is an overreaction, in which the emotional response is much more extreme than it should be for the presenting situation. Alternately, a recovering addict may also have periods of numbness in which they seem to no longer have the ability to emotionally feel anything. These symptoms can cause stress and tension in relationships with family, friends, and the workplace. Sleep disturbance is another big issue in post-acute withdrawal individuals. An inability to get enough sleep makes situations feel even more overwhelming and stressful, causing a feeling of giving up and relapsing into drug use can feel like the answer to fixing these problems. Physical discoordination can be a serious, although less common symptom. This is exhibited by stumbling and clumsiness. This behavior is often labeled as dry drunk because it can appear that the person is drunken in their type of clumsiness, but they actually have no chemical in their body. Stress sensitivity is probably the most significant symptom that leads to relapse of opioid use. Those in recovery cannot distinguish situations of low stress from some situations of high stress, which causes confusion and frustration. They may feel stress in a situation that would normally not elicit a stress reaction. To make things worse, all of the symptoms of post-acute withdrawal symptoms seem to worsen in periods of increased stress, causing a cycle of stressful events. At times of low stress, the symptoms of pause are lessened or may even go away completely. When symptoms of pause do occur, it is important to get them under control as soon as possible. Symptoms can take on many patterns, but are generally categorized as regenerative, getting better over time, degenerative, getting worse over time, intermittent, which is episodic symptoms where you have periods of symptoms and periods of feeling completely normal, and stable, where the symptoms remain relatively the same throughout. With management, degenerative symptoms can become stable, stable can become regenerative, and regenerative can become intermittent. There are many techniques to help assist recovering addicts in controlling their symptoms. Verbalization and ventilation are important in order for these individuals to control their symptoms. They need to be able to express their feelings, concerns, and frustrations with someone who will be supportive and not minimalize their feelings. This includes expressing all thoughts and feelings, even though they may not be rational. This process can be very therapeutic and healing. Reality testing is asking someone if they make sense, not just in what they are saying, but also in their behavior. It is possible for the recovering addict is seeing things in a way that is different from reality, and this helps them grasp where they truly stand in relationship to different situations. Problem solving and goal setting are essential to moving through pause symptoms. This helps give them control over their own lives and decide what's important to them and giving them direction. Backtracking is helpful in finding out what started the current episode of pause symptoms. If a situation can be discovered in initiating the pause symptoms, then the individual can do their best to avoid those situations, or at least be aware that they are at risk for developing symptoms when the situation is unavoidable. Backtracking can also be used to help discover what helps stop the symptoms the best, so that it can be used next time the symptoms worsen. Education and retraining are important in order to understand what to expect during the recovery period. This helps those recovering understand what is going on in their bodies and what is normal to expect and options for coping. This can help take away the anxiety associated with symptoms. Self-protective behavior enables a recovering person to take control of their symptoms and keep them aware of the people and the situations that worsen their symptoms and protect themselves from those influences. They learn to change situations, avoid them, change their reactions, or interrupt them in order to prevent their symptoms from becoming out of control. Nutrition is important in recovery as well. Eating a balanced meal with nutritious foods can help the body work at its best, leading to a more controlled disposition. Decreased sugar and caffeine also greatly help stabilize moods. Exercise is a great coping mechanism to help deal with post-acute withdrawal symptoms as well. It can help release endorphins that help the body feel relaxed, calm, strong, and in control. In this case, exercise should always be something that is fun and that decreases stress. Exercise that is too stressful on the body should be avoided during this period of time, as it can actually worsen the pause symptoms. Relaxation techniques have been proven to be very beneficial. This can take the form of meditation, soft music, or a walk in a soothing environment. This will help decrease the stress that worsens withdrawal symptoms. Spirituality is defined as an active relationship with a power greater than yourself that gives your life meaning and purpose. A focus on spirituality is a belief in a higher power that takes the person in recovery out of the center of things and allows them to let go of focusing on their own limitations and weaknesses. There is no one higher power that a person must believe in to benefit from spirituality. It is simply being open to the possibility of a higher power than themselves. Balanced living is attempting to live a life that is physically, psychologically, socially, and spiritually in harmony. It means being able to be responsible, but also allowing time for job, family, and friends, and not neglecting self. Medications can be used to assist with systems, recovery, and prevent relapse. Often, buprenorphine or methadone can be used in the acute setting to limit symptoms during withdrawal and are then stopped. However, at times when a patient continues to relapse, medication can be the buffer needed to reduce symptoms and cravings for the opioids. There are several choices for medications if needed to help prevent relapse. Methadone has historically been used to help with addiction recovery. It is a long-acting opioid medication. Although methadone is an opioid, it has a lower, steadier effect on the body and has been helpful in being used as a maintenance to prevent relapse. This help allows the patient to focus on building relationships, holding down a job, and getting their life back on track. Naltrexone can be used after an addict has detoxed from opioids. Naltrexone binds with the opioid receptors 100 times more strongly than opioids. This prevents the reward system from being triggered by opioids, which causes less motivation to continue using. Buprenorphine at low doses works similar to methadone and helps relieve the symptoms of withdrawal. At higher doses, it works more like naltrexone and can block the receptors so strongly that it causes withdrawals on highly dependent patients. Buprenorphine is commonly used in the acute withdrawal setting to assist in the physical withdrawal symptoms, but it is also commonly used to help maintain abstinence from uncontrolled substances and help them maintain a stable life. As discussed, these post-acute withdrawal symptoms can strongly affect the addict and their recovery. Understanding these symptoms, how to cope, and knowing options for support greatly increase the addict's ability to prevent relapse. However, the addict is not the only person affected by PAWS. Symptoms of forgetfulness, mood swings, and an inability to focus can greatly affect jobs and relationships with family and friends, causing frustration and anger and tension to all those involved who do not understand that this is all part of the brain's recovery from drug addiction. Understanding PAWS not only affects the addict as they recover, but also all those around the addict. An understanding of what is taking place in the brain of the recovering addict helps the rest of their community understand and support them through their recovery. With the community and the addict working together, we can improve an overall population health. It is important to remember that there is life after addiction. Knowledge on the recovery period will help a recovering addict stay on track and know what to expect in order to prevent relapse. Knowledge can also assist them in developing healthy coping mechanisms to replace old, destructive behaviors. Establishing a support system will help a person in recovery stay on track as well. These people need to be supportive and honest with the addict. Remember to encourage hope in these individuals and remind them that they should take one day at a time. Reasonable expectations are very important to the recovery process. They must remember that life will not be perfect now that they are no longer an addict. Some days will be wonderful and others will be a struggle, and that is real life. But they can now make it through those tough days in a healthier way. Life goes on. It will be a struggle at times, but it will also be beautiful. Thank you for listening to my PowerPoint on the post-acute withdrawal symptoms.